So then what about gastric cancer, stomach cancer? This was one of the earlier kind of studies by a famous Hipec surgeon. And what he showed is that for patients that you're able to fully cytoreduce, so get the tumor down to where we can't see anymore, they had the best survival. And compared to controls for patients with gastric cancer, or historical, kind of the average, similarly to what I mentioned earlier for colon cancer, but compared to the kind of historic averages for chemotherapy alone, if you were able to get rid of all of the tumor with the cytoreduction, the patients did pretty well with stomach cancer, relatively speaking, at least. And so this was also true if they had kind of less disease burden. So they had a lower PCI, so a lower amount of disease. Those patients were actually there. You can see that there are some survivors out here several years later. And so this was one of the early studies that showed that this was a promising therapy. Again, in selected patients, I think patients that have a high amount of disease and you're not able to get rid of all of the tumor didn't really have that same benefit and kind of only were exposed to the risks of surgery. So with the right patients, there can be a benefit though. And so similar to when we asked the question about does the Hipec add something, I think that the data is a little bit better for stomach cancer that the Hipec does add something in this case. This was a randomized controlled trial, again, out of China that was looking at, in the yellow, the cytoreduction alone versus the cytoreduction plus the chemotherapy bath, the Hipec. And those patients did better with the Hipec. And then similarly in Europe, this wasn't a randomized controlled trial, but they did some statistics and sort of matched the two groups up as best as they could. Outside of a trial, I think that was a pretty good way to look at this. And they looked at the cytoreduction alone, just that part of the surgery in red, but the Hipec for stomach cancer, I think added something. So kind of putting them together, I think that the cytoreduction and the Hipec for gastric cancer, together, I think they show a benefit compared to cytoreduction alone. There was another trial here that was done looking at this and another kind of Hipec regimen looking at the cytoreduction surgery versus plus the Hipec versus alone. So these are hard trials to do, and recruitment was slow in this case, and so the trial had to be stopped. And what they didn't see a difference in survival between the two groups, but they did show less progression, or a longer time before any kind of progression happened. It was twice as long in the Hipec group. And so, maybe the survival benefit didn't materialize because it was stopped early and there were too few patients. But I think this improved time before any kind of progression happened was encouraging still, even though the trial was kind of incomplete. And there is one more other trial that's kind of ongoing, or at least the results are still pending. They haven't been published yet, called Periscope 2, again, looking at stomach cancer and kind of evaluating Hipec surgery. So all in all, I still think, even though I still think that Hipec is with cytoreduction can benefit patients selectively with gastric cancer, stomach cancer.